Infections. Infections are the soul-crushing injuries of medical care. You go into a hospital, you face a procedure courageously, you try to recover, and you're brutalized by an infection you get in the hospital. And it's oh so common. It kills over 100,000 people per year, hospital infections. You've heard of them: MRSA, C. diff, VRE, vancomycin-resistant enterococcus. These are brutal. These are brutal, and you don't want a bloodstream infection. So, what can you do? There are so many things that we know that we can do. You enforce hand hygiene. Every one of these bundles for surgery, for central lines, for ventilators, for every procedure starts with hand hygiene. How hard can it be for providers to wash their hands? Apparently it's pretty hard. And what we do typically is we have nurses go around spying on people to make sure that they wash their hands. And if they don't, they get, like, a traffic ticket or something. Yes?
Does that sanitation lotion that they all use in the hospital now, is that effective as washing for 15 minutes?
No, you don't wash for 15 minutes. You have to wash for 15 seconds.
15 seconds?
Yeah, and there are some things that and I'm not going to go through them all today, but in a hospital they should know. There are some things that it's more successful to wash with soap and water than it is to use the alcohol dispenser. Okay, but 15 seconds, that's key. And it just won't, most of the time, doctors and nurses are in a hurry. A lot of times they don't do it. A lot of times they'll come into your room, their gloves are already on. You have to say, did you just scrub? Or are you coming from another room with those gloves on? Because it's fundamental. You don't want to get an infection, and you stop them if you can. Now, the best way to start to enforce hand hygiene is to have a camera by the alcohol dispenser or by the sink and make sure that the doctor does it. Doctors are afraid that somebody will review it, and that has a deterrent effect on their behavior. Now, a lot of people talk about MRSA. We have methicillin-resistant Staphylococcus aureus infection. We have an epidemic of that in this country. It's a brutal infection. You don't want to get it, okay? Well, how does MRSA get into a hospital? People bring it in, mostly patients. What they do in other countries, like the United Kingdom and Holland, but we don't do it here, and I cannot tell you why, is we swab people's noses in hospitals, we culture it, and if they have MRSA, either as an infection or the germs are colonizing, very specific protocols are implemented. And one is you isolate the patient. You don't move the patient around a lot. You put the patient, if necessary, with other MRSA patients. You don't only wash every time you go into a room, you take a new gown and new mask, and they're disposable, and you get rid of it before you go into the next room. And when those MRSA protections are done, MRSA goes down. And in this country, it's the majority of staph infections. In other countries where there are better MRSA controls, it's the minority. And the other staph infections are obviously more open to, or more receptive to intervention with antibiotics. MRSA is more complicated. We have an epidemic in this country still of bed sores and blood clots, almost completely preventable. Everyone, particularly everyone elderly, but everyone having certain surgical procedures like a hip or a knee or gut surgery should have, or intracranial surgery, should be screened for blood clots. And if you're screened for blood clots, then you can have anticoagulation. You can have pressure devices, including some that, like automatic, they kind of squeeze you and things like that. You can bring down blood clots to almost nothing if you screen. Bed sores. Bed sores, a blood clot that starts in the hospital is an error. You shouldn't get a blood clot in the hospital. It is not a necessary frictional aspect of patient care. Should ask for screening, so you can have an anti-clotting protocol. Bed sores shouldn't occur in a hospital. Should not occur. If a bed sore occurs in a hospital, and bed sores are very serious. If you've known anyone who had one, or you've had one yourself, they are killers. They'll kill you. 60,000 people in this country die from bed sores. And that complicates care tremendously, even if you don't die. It lengthens care, gives you an infection. It's really pretty nasty to get a bed sore. But people can be screened for bed sores. Is the person immobile ordinarily? In other words, not moving around. Is the person moist? Probably due to incontinence. Is the person well nourished? That leads to bed sores. Is the person well irrigated, getting enough water? Is the person elderly? Okay. There are tests. Two nurses in Nebraska invented something called the Braden scale. I won't go over how you score it or anything like that. But people should be scored on the Braden scale to see if they need interventions. What are typical interventions? You got to be turned less than every 2 hours. And you may need special bedding, a special type of soft mattress, soft bedding, and you may need special wound care. You may need to, for example, if you start to develop one, well, first of all, people have to inspect you if you're at risk. When you're screened for bed sores, you should be inspected. Okay, your whole body should be inspected because bed sores can develop anywhere where you have a thin level of skin over a bony protuberance, such as in the sacral coccyx area, which is the main area. Nobody should get a bed sore. It shouldn't be expected. We shouldn't be complacent about it. Okay, so bed sores.